Hello everyone, if you're over 60 years old. Today I would like to talk to you about vascular health and a powerful drink that is easy to make and drink regularly, which may be beneficial to your cardiovascular system. As people age, the accumulation of deposits on the inner walls of arteries, the decline in elasticity, and the obstruction of blood flow are common troubles for many. We need not panic, but we should not overlook the fact that good living habits and appropriate nutritional intervention can significantly reduce the risk of cardiovascular and cerebrovascular events, making our later years easier and more energetic. This content is prepared for you who want to take the initiative to care for yourself and are willing to try natural methods. Don't forget to subscribe and like it so that you won't miss a very useful channel. We will introduce more daily foods and drinks that can quietly improve your health from the inside out. Please communicate with your attending doctor before adopting it, especially if you are taking medication or have chronic diseases. The core idea of this drink is to use natural ingredients to provide antioxidants, natural nitrates, anti-inflammatory components, and substances that dissolve mild blood viscosity, thereby helping to improve blood flow and vascular endothelial function. What's important is that no dietary therapy is an immediate miracle drug, but rather an auxiliary plan that is long-term combined with dietary adjustments, weight control, regular exercise, and medical advice. The combination we recommend today is simple, common, and relatively safe, but individual differences must also be treated with caution. The main ingredients of the recipe include fresh beets, pomegranate juice, lemon, a small amount of ginger, and 1 clove of garlic, along with a little high-quality olive oil or a small amount of flaxseed oil to provide healthy fats. Beets are rich in natural nitrates, which can be converted into nitric oxide in the body, helping to dilate blood vessels and improve blood flow. Pomegranates are rich in polyphenol antioxidants. Studies have shown that they are beneficial for protecting vascular endothelium and reducing oxidative stress. Lemon provides vitamin C and promotes the coordinated work of the antioxidant network. Ginger and garlic have mild anti-inflammatory effects and can improve blood rheology. Healthy fats help absorb fat-soluble nutrients from plants. Combining these ingredients reasonably can not only make the taste more palatable, but also enhance the nutritional synergy effect. The method of making is very simple. Take a small cooked or roasted beet, peeled and cut into pieces. Half a cup of pure pomegranate juice, sugar-free or self-squeezed is best. Half a lemon's juice, about a small piece of peeled ginger, and a lightly pressed clove of garlic, and put them into a blender. Add 1 tablespoon of olive oil or 1 tablespoon of flaxseed oil, and then add an appropriate amount of water as needed to adjust the consistency. Stir until smooth. If you don't like the pungency of garlic, you can roast it lightly before using it. The taste will be much milder. If you prefer cold drinks, you can also add a few ice cubes or cold boiled water. It is recommended to start gently. Drink a small cup, about 150 to 200 milliliters, every day for 2 to 4 weeks continuously, and observe your body's reaction and subjective feeling. If there is no discomfort, the frequency can be adjusted to 1 cup every other day or several times a week, depending on personal tolerance and medical advice. Please note that both beets and pomegranates contain natural sugar. Diabetic patients need to adjust the amount and frequency under the guidance of a doctor or a nutritionist to avoid fluctuations in blood sugar. When adopting any natural therapy, it is essential to pay attention to drug interactions. If you are taking anticoagulants, such as warfarin, etc., low molecular weight heparin, or other drugs that affect blood clotting, be sure to consult a doctor first. Some natural ingredients may enhance the anticoagulant effect or interact with prescription drugs, directly affecting safety. In addition, if you have a history of kidney insufficiency, severe heart disease, or are allergic to some of these ingredients, you should also be cautious or avoid trying them. Apart from the beverages themselves, the key to truly protecting blood vessels lies in comprehensive management, reasonably controlling blood pressure, blood sugar, and blood lipids, maintaining moderate and regular aerobic and strength training, quitting smoking and limiting alcohol intake, ensuring adequate sleep and stress relief. Beverages can be a beneficial supplement, but they cannot replace antihypertensive drugs, lipid-lowering drugs, or a doctor's treatment plan. If your physical examination has indicated atherosclerotic plaques or stenosis, please discuss a comprehensive treatment plan with a cardiovascular specialist. In daily diet, some adjustments can also be made to complement the effects of this drink. Increase the intake of whole grains and legumes rich in dietary fiber. Consume deep-sea fish rich in omega-3 fatty acids. Choose high-quality vegetable oil. Eat less processed foods and high-salt foods, and consume more fruits and vegetables, especially berries. Green leafy vegetables and onions that are rich in flavonoids and antioxidants. Weight control is equally important. Even a reduction of 5% to 10% in body weight can significantly improve blood lipids and blood pressure. When making this drink, there are a few tips to enhance the taste and effect. Beets that have been roasted or steamed taste sweeter and are easier to digest, while reducing the possible discomfort when eaten raw. Pomegranate juice is the best choice if it can be squeezed by oneself without adding sugar. Lemon can neutralize the sweetness in beverages, making the taste fresh. After adding olive oil, slightly shaking or stirring can dissolve some of the active ingredients in the fat and help with absorption. If you are worried about the taste being too strong, you can pair the drink with your breakfast, such as oatmeal or whole wheat bread. For many people, trying new dietary therapy methods is often accompanied by doubts. How long will it take for me to see results? Can arterial blockage be completely cleared? The answer is that natural beverages are more of a gradual way of conditioning. They can improve vascular endothelial function, reduce oxidative stress and inflammation, and help maintain cardiovascular metabolic health. But they cannot guarantee the reversal of existing large amounts of calcification or severe stenosis. If there is a clear diagnosis of arterial obstruction, necessary medication or interventional treatment should be carried out as prescribed by a doctor, and diet should be used as an auxiliary strategy. In terms of safety and common side effects, these ingredients are generally safe, but there are individual differences. Beets may cause urine or feces to appear red or pink. This is harmless bacteria, but if accompanied by other symptoms, medical attention should be sought. Garlic and ginger may cause gastrointestinal discomfort or heartburn in some people. It is recommended to start with a small amount. Although pomegranate juice is healthy, sugar-sweetened products available on the market should be avoided. Diabetic patients should pay attention to their total sugar intake. If you are willing to integrate this plan into your daily life for a long time, you can make the drink a weekly habit, 2 to 4 times a week, combined with 3 to 5 aerobic exercises, such as brisk walking, swimming, or cycling, and 2 simple strength training sessions per week. Regularly check your blood pressure, blood lipid, and blood sugar levels, and communicate the observation results with your doctor. Adjust your diet and medication plan if necessary. Remember, persistent lifestyle changes are more reliable than any short-term, exciting folk remedies. Add a few optional ingredients and variants. If you like the taste of green tea, you can add half a cup of cooled green tea to your drink to increase catechin antioxidants. If you want to enhance the anti-inflammatory effect, you can add a small amount of turmeric powder, but turmeric taken together with black pepper can be better absorbed. For those who prefer a refreshing taste, you can add cucumber slices or mint leaves for seasoning. For those who are not tolerant of raw garlic, roasted garlic or garlic powder can also be used as a substitute, but it is important to control the amount. It is recommended that the beverage be refrigerated for no more than 48 hours after preparation. The taste and active ingredients will gradually decline over time. It is best to drink it immediately after preparation. When to seek medical attention promptly. If you experience chest pain, chest tightness, severe breathing difficulties, fainting, weakness on one side of the body, or language disorders, you should seek medical attention immediately. These could be warning signs of myocardial ischemia or cerebrovascular events and have nothing to do with any beverages. If you notice obvious bleeding, rashes, or abnormal blood pressure after taking a new drink, you should stop using it and consult a doctor. Finally, taking good care of cardiovascular health is a long-term project. Combining scientific methods with daily habits will lead to more stable and safer results. That's all for today's sharing. Don't forget to subscribe and like so you won't miss the next video. we'll delve into more daily foods and drinks that can quietly improve your health from the inside out.